Morning everyone, Dr. Lance here with our episode 3 on stress and the cortisol response. Today we're going to talk about menstrual dysfunction, and I think this is an important one. It's one that I've actually seen in my clinic quite a bit over the last couple of months. A lot of women that I've had coming in with abnormal periods or other menstrual issues. Or even women that are menopausal or postmenopausal that have been having unusual symptoms. While I think it's really important to rule out the scary stuff, which is kind of where the primary clinical perspective comes in, we do need to talk about the stress and cortisol response here, and that's where we're going to go now. So let's go back to our first picture. You guys are probably well familiar with the happy kidney and the kidney hats or the adrenal glands. So going back to here, remember in the first lecture, we talked about steroid hormones and what a steroid hormone means. So a steroid hormone is a hormone that has a cholesterol base, okay? There are two primary hormones well, there are three, and I'll talk about the third one today as well, but we'll leave it for another lecture. There are kind of three primary steroid hormones we think about. So there are sex hormones, there are cortisol, and then one more that I never mentioned in the previous lecture is another one called aldosterone, okay? Right? So these steroid hormones, right, we go back to cortisol, which is the stress hormone, which creates that stress, which is responsible for the stress response, the stimulation of the sympathetic nervous system. And then we have these two other hormones that work from the same resource. Sex hormones, which you know about, so progesterone, estrogen, testosterone, and aldosterone, which is another one that actually comes from pregnenolone, which is a precursor for the sex hormones. I'll talk about this and make a diagram in a minute. Aldosterone is more specifically for salt and water retention. So this has an effect on blood pressure. And I think that is an important connection to also think about as well when we think about stress. I don't think this is the primary issue. It's pretty far down in terms of the creation of it on the spectrum of steroid hormones. So let's go a little bit more into the specifics of the sex hormones. Okay, we're gonna start a new page this time. So, right, we've got cortisol, and we've got what else do we have? Pregnenolone, I forgot how to spell. Pregnenolone, yeah. So we've got these two things. This is the primary thing we're going to talk about, right? Both of those come from cholesterol, okay? And what happens is when we're under stress, we talked about this in a previous lecture, what generally is going to happen is the body's going to preferentially switch for at least a short period of time to the production of cortisol because that's where the resources need to go. In the short term, this is not an issue, but with people where there's chronic stress, we have this long-term shift, right, away from the production of sex hormones. And for me, I think this is an easy way to think about why there is a relationship between stress and the stress response and menstrual irregularities, which there is a pretty common connection. So we've got pregnenolone, just for the sake of education. Pregnenolone is responsible for the production of progesterone. Writing this down. So we've got progesterone here. It's also, and then from there, right, we get from here the production of a whole bunch of other steroid hormones. We've got DHEA, right? We've got testosterone and estrogen, right? And we'll just kind of write those down as T and E. And there's a lot of crossover between these different hormones as well, right? Some hormones are testosterone, some testosterone contributes to the production of estrogen. DHEA contributes to production of testosterone and estrogen, and progesterone contributes to a lot of these as well. So there's a lot of crossover. So when we're switching to this cortisol axis, we're having a really significant effect on the balance of these hormonal systems. And this is also, I think, important for when you think about stress and testosterone production, okay? So there we have it. We have the cortisol response, we have the effects on sex hormone production. And one thing I want to highlight that I think is really interesting here, because I come from the Chinese medicine perspective as well, is for centuries, Chinese medicine has been saying something actually quite similar in terms of how the body functions and stresses effect on the menstrual cycle. So we have 5 central organs in Chinese medicine. I'm only going to focus on one, right? And that's the liver. And when we talk about liver in Chinese medicine, we don't talk about the physiological liver. We're not talking about the organ. We're talking about a metaphor for function. And in Chinese medicine, we talk about the liver being the governor of the free flow of qi through the body, or energy flow. And liver has an association with stress. So in Chinese medicine, we talk about the stress response, depression, agitation, being associated with liver. Liver also has an association with the menstrual cycle, right? With blood flow, with menstrual blood. And so it's interesting that the Chinese medicine texts talk about how when the liver is out of whack, you can actually have problems with with the menstrual cycle, with sexual function, with bleeding. And I just think that's a really interesting connection, because they determined something hundreds of years ago that we only recently, in the last maybe 100 years, have started talking about in terms of probably even less than that, in terms of hormones and hormone production. So I think that's really interesting. So this goes back to kind of what we do when I'm dealing with menstrual irregularities. Of course, the first thing is moderating stress, and there are so many different ways of doing that. For some, it's yoga practice. Sometimes it's exercise. I almost always use meditation and breathing, because I think that they're some of the most effective ways to moderate the cortisol and the stress response. Getting good sleep, all of these things are really important. There are things as a naturopath that I put a lot of focus on helping my patients to balance. There are herbal alternatives, right? So I think I do tend to lean a little bit more towards Chinese herbs when I'm dealing with menstrual issues. I've had a lot of success with a bunch of different things: premenstrual dysphoric disorder, just plain old PMS, or abnormal bleeding. Chinese medicine suits itself really well to dealing with menstrual issues. One of my favorite Chinese formulas is called Xiao Yao San for kind of, it's the standard if I think of menstrual irregularities, and I think it's a great formula. It contains an herb in it called dungui, or Angelica sinensis, which is kind of one of our really common go-to for the female reproduction system. Angelica sinensis. There's a lot of good research out there on this. It's pretty frequently used in natural medicine, integrative medicine. Dungui. The thing about Chinese herbal formulas is they're mixed with a bunch of other herbs. So you're not just looking at the effect of one specific herb on the body. You have this kind of conglomeration of different effects. So it's not a one-size-fits-all approach. So there are hormone balancers. So sometimes I think about that as a piece of working with menstrual irregularity on top of moderating stress. Stress. We have to go back to what the primary cause is. And like I said, by this point, we have either ruled out more serious issues that need to be addressed with either medication or more strong herbal supplementation or other treatment modalities, or we're working on that already and we're moderating the stress response if there is one in between. And for those of us who don't have any of those really serious issues, then we focus more specifically on stress. These things take a while to change, and that's what I tell my patients is don't expect immediate improvement. we look for gradual change in the body. But hopefully this helps to illustrate why this tends to be connected in terms of the stress and menstrual regulation. So if you have questions, please feel free to ask me. You can send me a direct message. I am still seeing patients via Zoom. Hopefully our clinic will open up again soon, but a lot of this stuff I can deal with online as needed. So thank you, and have a great rest of your week.